Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering personality disorders. When it comes to psych, these types of patients are the hardest patients to care for because they will test your patience. Okay, so we're going to cover all types of personality disorders. If you haven't done so already, please be sure to like and subscribe below. Make sure you press that red notification bell, I should say, so you'll know every time a new video is released. So without any further ado, guys, let's get started. First question. During an assessment interview, a client diagnosed with antisocial personality disorders spits, curses, and refuses to answer questions. Which is the appropriate nursing response to this behavior? A, you're very disrespectful. You need to learn to control yourself. B, I understand that you are angry, but this behavior will not be tolerated. C, what behaviors could you modify to improve the situation? Or D, what anti-personality disorder medications have helped you in the past? Okay, guys, if you're new to my channel, if you feel like my pace is too fast, just go ahead, press the pause button, think about your answer. Whenever you're ready, press play and we'll resume. So guys, the correct answer is B. I understand that you're angry, but this behavior will not be tolerated. So the first part of this answer, I understand that you're angry. What are you doing? You're acknowledging that patient's feelings, right? And the second part, where you let that patient know that it will not be tolerated, what are you doing? You're establishing boundaries. And let me tell you something. When it comes to personality disorders, you have to have clear-cut boundaries because these types of patients will push that envelope, all right? When it comes to personality disorders, these patients, what they're feeling on the inside, the way it's expressed, their behavioral expression on the outside is inappropriate, and you do have to set those boundaries, okay? So let's look at the wrong answer choices. We have A, you're very disrespectful. You need to control yourself. Are we ever confrontational in nursing? Absolutely not. That's not therapeutic. It's not going to help the patient. Choice C, what behaviors could you modify to improve the situation? You can ask that later. Not now while that patient's angry, okay? Later, after that patient's calmed down and they're willing and receptive to having therapeutic communication, you can discuss those ideas, but not now. Choice D, what anti-personality disorder medications have helped you in the past? That's not appropriate to ask. That's number one, that's not appropriate to ask. And number two, obviously those meds didn't help that much, right? Because here we are. Okay, so the correct answer is B. You're acknowledging that patient's feelings, but you're also setting limits and boundaries, which these type of patients need. All right, question 2. A client diagnosed with antisocial personality disorder comes to the nurse's station at 11 p.m. requesting to phone a lawyer to discuss filing for a divorce. The unit rules state that no phone calls are permitted after 10 p.m. Which nursing diagnosis is most important? Which nursing response is most important? A, go ahead and use the phone. I know this pending divorce is stressful. B, you know better than to break the rules. I'm surprised at you. C, it's after 10 p.m. phone curfew. You'll be able to call tomorrow. Or D, the decision to divorce should not be considered until after you have a good night's sleep. And I'll give you a moment to think of your answer. So the correct answer is C. It's after the curfew. You'll be able to call tomorrow during the allowed times. Now, again, patients with personality disorders, especially antisocial personality, borderline personality, you must set strict boundaries, strict limits, and stick to it, okay? Because these patients are very manipulative and it'll cause splitting. I'll talk to you about splitting in a little bit. But This is the second question that we got on personality, on antisocial disorder. So let's talk about this for a little bit. When you hear antisocial, you see people saying, oh, I'm antisocial. When they use that phrase in that context, that means they don't like being around people, right? So that is very tricky when it comes to nursing, because in nursing and in psych, when a patient has antisocial personality disorder, that's the opposite. They love being around people. Why? Those patients with antisocial personality disorders, they're the con man, okay? They are social chameleons, so they will be who you want them to be, when you want them to be, where you want them to be it, to get whatever it is that they want from you. All right. So you can have a 19-year-old patient with antisocial personality, and he will marry a 98-year-old grandma to steal all the inheritance of her children. So these patients with antisocial personality disorders, they're really not antisocial. They're very social. They love conning people out of money, sex, whatever it is that they want from that person. They will lie and steal and not feel bad about it. That is your antisocial personality disorder. They will, and in the clinical setting, they will try pushing the envelope to see how far that they can get with you, the nurse, to see how much they can get away with. And that is why you cannot make any exceptions, okay? So the correct answer is C. Now let's look at our other choices. A, go ahead, use the phone. I know this pending divorce is stressful. Absolutely not. You have to follow the rules. You have to reinforce the rules, okay? Because they will test those limits and boundaries, and these patients are very manipulative. B, you know better than to break the rules. I'm surprised at you. You're putting the patient on defense. There's no reason for that. It's not therapeutic. Choice D, the decision to divorce should not be considered until you've had a good night's sleep. In nursing, do we give advice? No. Absolutely not. So the correct answer is C. A client diagnosed with paranoid personality disorder becomes violent on a unit. Which nursing intervention is most appropriate? A, provide objective evidence that reasons for violence are unwarranted. B, initially restrain the client to maintain safety. C, use clear, calm statements and a confident physical stance. Or D, empathize with the client's paranoid perceptions. This coffee is so good. Okay, guys, so the correct answer is C. Use clear, calm statements in a confident, a reasonable stance. So when you go back to the question, they tell you that the patient's paranoid and they become violent on the unit. So what you do in psych, patient starts acting up, you're going to give them a firm verbal telling them that they need to calm down and they need to calm down now. Okay, that is the first thing you're going to do, which is your answer C. If that does not work, then you will have to go to B, where you'll restrain the patient. Now, don't forget, at the same time, you're making sure your patients are safe, right? So you're going to, number one, tell them that they need to calm down right now, and you say it firmly, let them know that you mean it, and then to restrain them if necessary. So the correct answer is C. So let's go through the other choices. A. I literally can't even with that choice, with A. Look at what it says. Provide objective evidence that reasons for violence are we don't have time for all of that, okay? We don't have time for all of that. What does the question say? It says that they're becoming violent. That's not the time for explanations. So that's wrong. Choice B, that would be our second action if C didn't work. And then choice D. Stop it. Do you ever give credence to any hallucinations that a patients have or a delusion? Absolutely not. Look at what D says. Empathize with their paranoid perceptions? Never. You never do that. Okay? If a patient's having a paranoid perception, What's your job as a nurse? To bring them back to reality, okay? So the correct answer is C. All right, next question. A highly emotional client presents at an outpatient clinic appointment wearing flamboyant attire, spiked heels, and theatrical makeup. Which personality disorder should a nurse associate with this disorder? A, compulsive personality disorder. B, schizotypal personality disorder. C, histrionic personality disorder, or D, manic personality disorder. And I'll give you guys a moment to think of your answer. And the correct answer is C, histrionic personality disorder. These are the drama queens or the drama majors, right? These are the attention seekers. So they will dress in a way to get attention. And they don't care if it's positive or negative attention, as long as all eyes are on who? All eyes on me, right? So I just turned into Tupac. All right. So let's go over the other choices. A, compulsive personality disorder. The core of these patients that have compulsive personality disorders is anxiety, okay? And we'll talk about that. So those patients that have OCD, the underlying issue is anxiety, right? And that's what causes them to compulsively turn off the lights or check the lights or check the faucets, whatever it is, all right? Choice B, schizotypal personality disorder. This baseline for that is psychosis. What is psychosis? When the patient's out of touch with reality, right? So they may have hallucinations, hearing or seeing things that are not real. C, histrionic. I talked to you about that. Those are your attention seekers. And then D, manic personality disorder. These are the patients who are on 100 all the time. You know that phrase, 0 to 100? That patient is on 100, 24/7. Our biggest concerns for those types of patients is what? Fluid and electrolytes, nutrition, because they don't even stop to eat. They don't stop to sleep. They don't stop to drink, okay? So the correct answer for this one is histrionic personality disorder. Next question. A client diagnosed with borderline personality disorder brings up a conflict with the staff in a community meeting and develops a following of clients who unreasonably demand modification of unit rules. How can the nursing staff best handle the situation? A, allow clients to apply the democratic process when developing unit rules. B, maintain consistency of care by open communication and avoid staff manipulation. C, allow the client spokesperson to verbalize concerns during a unit staff meeting. D, maintain unit order by application of autocratic leadership. And I'll give you a moment to think of your answer. Okay, guys, so the correct answer is B. Maintain consistency, that's a key word, by open communication to avoid staff manipulation. Look at the personality that we're dealing with, borderline personality disorder. They are very manipulative. Remember I told you, you're antisocial, you're borderline, very manipulative, and they will try to cause splitting. What is splitting? In psych, splitting can mean two things. The first splitting, that is when, and especially with the borderline patients, you're either all good or you're all bad. So if they get their way, you do what they want, oh my gosh, Nurse Professor D, you are the best nurse in the world. All the other nurses here are horrible. They need to be fired. They need to hire more nurses like you because, you're the only one who knows how to take care of me. But the minute you say no, the minute you don't do what they want, all of a sudden, you're the worst nurse in the world. They have all these complaints about you. They're going to the nurse manager to say how horrible you are and how you almost killed them, right? The other type of splitting is where, again, manipulation, they will split the staff, okay? And how does that come in? You're caring for the patient and that the patient will say, oh, you know, you're the best. This other nurse never does that. And so they try to pit the nurses against each other. Okay, and you have to avoid that from happening, because you can't be therapeutic if the staff is split. All right, so now let's talk about the wrong answer choices, because I talked about the right one. You want to have consistency. You want to avoid manipulation. You want to avoid splitting of the staff, right? Now, what are the wrong choices? A, allow clients to apply the democratic process when developing unit rules. Excuse me, they're on the unit for a reason, right? So you do that and you're just going to let them run the place into the ground. They're in the unit to get your help, not the other way around. So no, one, throw it out. Then you have choice C, allow client spokesperson to verbalize concerns during a unit meeting. Absolutely not. Because look at the question. Look what this patient already did. They have all these patients riled up unnecessarily. So if you were to do C, excuse me, before you know it, you have a mutiny on your hand. A mutiny that could have been avoided. That's wrong. Then you have D, maintain unit order by the application of autocratic leadership. Well, this is not a dictatorship, right? So we don't want to do that either. So the correct answer is B. You want to maintain consistency, and you want to make sure that you don't allow manipulation to set in for the staff to be split. Next question. Which nursing approach should be utilized to maintain a therapeutic relationship with a client diagnosed with borderline personality disorder? A, be firm, consistent, and empathetic while addressing specific client behaviors. B, promoting self-expression by implementing laissez-faire leadership. C, using authoritative leadership to help clients learn to conform to society norms. Or D, overlooking inappropriate behaviors to avoid providing secondary gains. And I'll give you a moment to think of your answer. So by now, I think you guys have guessed the correct answer. You guys have a good idea of how we treat these patients with borderline personality disorder. The correct answer is A. You want to be firm. Remember, you have to have very clear boundaries and be firm with them, okay? You have to be firm and consistent. Why? Because these patients are very manipulative and they will look for any crack in the armor, right? So if the rules are no phone calls until 10 o'clock in the morning, that means no phone calls until 10 o'clock in the morning, no exceptions. Empathic. I think they meant empathetic. So what does that mean? There's a difference between being sympathetic and empathetic. When you're sympathetic, so for example, if a patient had surgery and they're in pain, and they need to get up and walk, but you're being sympathetic, you're like, oh, okay, you know, you're in pain, I'll let you stay in bed. Same situation, but you're being empathetic. You tell the patient, I understand that you're in pain. I'll give you some analgesics to help, but I need you to get up and walk because I don't want you to develop pneumonia. I don't want you to develop a DVT. I don't want you to develop an embolism or pulmonary embolism. So being empathetic means you're acknowledging the patient's feelings, but at the same time, they still got to do what they got to do, right? So you want to be empathetic while addressing the specific behaviors. Because the whole point of treating personality disorders is helping what? Change their behavior, right? We have no control over their feelings. They may have no control over their feelings, but they can control the expression of their feelings. And what's the expression of their feelings? Behavior. So if they're angry, that's okay to be angry, but how are you going to express it? Are you going to verbalize, I'm angry, or are you going to go run that person over with your car? All right? So that's why A is the correct answer. Now let's look at the other choices. You have B, promoting self-expression by implementing laissez-faire leadership. You better not. Laissez-faire leadership is where you let everybody make their own decisions, right? You're really not leading. And they're going to run that place into the ground. So absolutely not. You're not going to have laissez-faire leadership. Laissez-faire leadership is when you take a hands-off approach and you just let everybody do what they want. No. C, using authoritative leadership to help clients to conform to society norms. That does not work. Not in psych, not with personality disorders. Okay? We want them to change. We want to teach them how to change their behaviors. We don't want them to change their behavior because we're being authoritative and they're just doing it because they're in the facility. But as soon as they get out, they're going to do what they want and go revert back to those non-therapeutic behaviors, right? So we don't want to do that. We're trying to teach them how to appropriately express their feelings, and we want them to appropriately, we want their behavior to be appropriate. So that's not right. And then you have D, overlooking inappropriate behaviors. Let me stop right there. Don't do that. Absolutely not. If a patient's displaying an inappropriate behavior, you need to address that. That is how you treat these clients. So that's wrong, overlooking inappropriate behaviors to avoid providing secondary gains. Never, ever, ever do that. That is wrong. All right, next question. Which adult client should a nurse identify as exhibiting the characteristics of a dependent personality disorder? A physically healthy client who's dependent on meeting social needs by contact with 15 cats. B, a physically healthy client who has a history of depending on intense relationships to meet basic needs. C, physically healthy client who lives with parents and depends on public transportation. Or D, physically healthy client who's serious, inflexible, perfectionistic, and depends on rules to provide security. So the correct answer, guys, is C, a physically healthy client who lives with parents and depends on public transportation. So we're talking about the patient with dependent personality, okay? So this type of patient, nothing's wrong with them. Physically, nothing's wrong with them. Mentally, nothing's wrong with them. But they depend on someone else to take care of them. And they tend to be very clingy and have a submissive, attitude. Okay, so a perfect example of that is the wife who refuses to work. She wants to be a housewife. Nothing wrong with that, but she refuses to take responsibility for anything. You ask her about any bills. Oh, I don't know. My husband takes care of that, and everything is my husband, my husband, my husband. And her whole livelihood is dependent on that one person. Nothing is wrong with her physically. Mentally, she can do math, but she just does not want to have that responsibility at all. She just wants it to go onto somebody else and to be dependent on that person. So C is the correct answer. There's nothing wrong with this person. They're physically healthy, and this is an adult. Well, it doesn't say adult, just healthy client, but we know this is an adult. And they're still living with their parents and depending on public transportation. All right? All right, next question. During an interview, which client statement to a nurse should indicate a potential diagnosis of schizotypal? Guys, I can't pronounce. Schizotypal personality disorder. A, I really don't have a problem. My family's inflexible and every relative is out to get me. B, I'm so excited about working with you. Have you noticed my new nail polish, ruby red roses? C, I spend all my time tending my bees. I know a whole lot of information about bees. Or D, I'm getting a message from beyond that we have been involved with each other in a previous life. Okay, guys, so the correct answer is D, I'm getting a message from beyond that we've been involved with each other in a previous life. Okay, so we're dealing with the schizotypal, you guys know I can pronounce, personality disorder, okay? What kind of disorder is this? I talked to you about this already. Psychosis. What does psychosis mean? That just means the patient's out of touch with reality, right? Look at D. I'm getting a message from beyond that we've been involved in a previous life. Okay, this patient's out of touch with reality, all right? Choices A, B, and C are wrong because none of these are delusions. None of these are false beliefs, but D is a false belief, okay? A nursing instructor is teaching students about clients diagnosed with histrionic personality disorder and the quality of their relationships. Which student statement indicates that learning has occurred? A, their dramatic style tends to make their interpersonal relationships quite interesting and fulfilling. B, their interpersonal relationships tend to be shallow and fleeting, serving their dependency needs. C, they tend to develop few relationships because they're strongly independent, but generally maintain deep affection. D, they pay particular attention to details which can frustrate the development of relationships. And I'll give you a moment to think of your answer. Okay, guys, so the correct answer is B. Their interpersonal relationship tends to be shallow and fleeting, serving their dependency needs. What kind of disorder are we talking about? We're talking about histrionic personality disorder. Now, a couple things I need to tell you about these type of patients. Remember, I told you those are the attention seekers, all eyes on me, and they'll do anything for attention. These type of patients, many of them tend to die accidentally from suicide. And I know what you're thinking. Well, for Professor D, how can someone die accidentally from suicide? Guys, I'm sorry, I gotta get this off my camera. There we go. How can someone die accidentally from suicide? So remember how I told you they're attention seekers? So many of them, what they'll do, for example, if they're inside of the facility, when it's change of shift, they know the new nurses are leaving at 3, the oncoming nurses are coming at 3. So they will slit their wrists, right? Because they timed it. They know usually their nurse comes to check on them by 3:15. So they slit their wrists so that when the nurse comes, oh my gosh, help, help, and she's rescued. And why do I say she? Most patients who have histrionic personality disorder are females, okay? So that's the example I'm using. But what happened on this shift was maybe the oncoming nurse was late. And so it was delayed, the room checks. And so now this patient bled out and died, but it was by accident. The patient really didn't want to commit suicide, okay? These patients with histrionic personality disorder, when they have, and I call them gestures because it's fake. They're really not trying to kill themselves. They're really not suicidal. They just want the attention, okay? They want to be rescued. So usually when they have these gestures of suicide, it's be something shallow. So for example, they'll take 2 Tylenols and open up the bottle and spread all the pills on their bed, and they just lie down like that and wait for the nurse to come in so they can rescue the patient. All right. So this is the type of patient that we're talking about when we talk about histrionic personality disorder. They're the drama queens. So the correct answer is C. Their interpersonal relationships tend to be shallow because it can't be deep. Why? Because they're all about them. All right. So it tends to be shallow and fleeting. If you're a lady and you're watching this, how long you think you're going to be able to keep a man with that type of personality? Not long, right? They're going to be out the door. And if you're a guy watching this, how long do you think your girlfriend's going to stick around with these type of attention-seeking behaviors? Okay? Not long. So the relationships tend to be fleeting and then serving their dependency needs. So every time they do get in a relationship, it's always with somebody that they look for somebody that can be their hero, that can save them, all right? So now let's look at our wrong answer choices. A, the dramatic style tends to make interpersonal relationships quite interesting and fulfilling. Absolutely not. People don't stick around. There's no time for it to be fulfilling because of that type of behavior. So no. They go from relationship to relationship to relationship, and they feel empty because those relationships are shallow. Choice C, they tend to have few relationships. That's true. because they are strongly independent. That's false. They are very dependent. They have that, oh, come save me attitude behavior. Strongly independent, but generally maintain deep affection, and that's false. Okay. Choice D, they pay particular attention to details. No, they don't. No, they don't. They can't focus on anything but themselves. D says they pay particular attention to details, which can frustrate development of relationships. And that's not true. They don't pay particular attention to details. So that's wrong. Okay. Everything in the world is about them. And I cannot believe I'm already out of time. Okay, guys, I'm going to sneak in one last question. One last question. All right, when planning care for a client diagnosed with borderline personality disorder, which self-harm behavior should the nurse expect the client to exhibit? And you guys should all get this right, because I just talked about this and I didn't realize I was going to be giving you the answer. So here we go. A, the use of highly lethal methods to commit suicide. B, the use of suicidal gestures to elicit a rescue response from others. C, the use of isolation and starvation as suicidal methods. Or D, the use of self-mutilation to decrease endorphins in the body. And I'm not even going to give you much time to think about it, because I just gave you the answer to this. We're talking about someone with borderline personality disorder, and the answer is B, they use suicidal gestures to elicit a rescue response by the nurse or from others, okay? And that's it, guys. You know what? I know I said I was going to squeeze one more. I'll squeeze this last one, and then we got to go. All right, which dressing diagnosis should be prioritized when providing nursing care to a client diagnosed with paranoid personality disorder? A, risk for violence directed towards others related to paranoid thinking. B, risk for suicide related to altered thought. C, altered sensory perception related to increased levels of anxiety. Or D, social isolation related to inability to relate to others. And the correct answer is A. All right. These patients are paranoid, but they're not paranoid of themselves. So these patients are not suicidal. They're paranoid of you and others, right? So they're paranoid, and the risk for harm is not towards self, it's towards others, okay, because of their paranoid thinking. So these type of patients, safety of the patients around them is your number one priority. All right. B, risk for suicide. No. That anger and aggression that they have is not towards themselves, it's towards others, because that's who they're paranoid about. So that's wrong. Choice C, altered sensory perception. Yes, they have altered sensory perception because many times they'll have delusions. But look at the rest of it. Related to increased levels of anxiety. No, it's related to their paranoia. So that's wrong. And then you have D, social isolation. Yes, many of them have social isolation because they don't trust anyone else, right? But look at the rest, related to inability to relate to others. No, it's related to their paranoia and delusional thoughts. So guys, I hope you found this video helpful. If you haven't done so already, guys, please make sure that you like this video and you subscribe to this page. Please make sure you press that red notification button. If you have any friends, classmates, anyone you know that is studying for their boards or is currently in nursing school, please share my videos. Guys, thank you so much. I felt like it was taking me forever to get to 1,000 subscribers, and I finally made it. I finally got to 1,000 subscribers a few days ago, so I'm so excited. Thank you so much, guys, and I'll see you on the next video.